Hello and welcome to Ovarian Cancer Australia's suite of information and support webinars. My name is Hayley and I'm the support coordinator here at OCA. Before we begin, I would like to acknowledge the traditional owners of the land on which we are standing and pay my respects to their elders past and present. I would also like to thank the Jack Brockhoff Foundation for providing us with the funding opportunity to deliver this project. Today's webinar is on the theme of living with hope and uncertainty, the emotional impact of diagnosis and treatment for ovarian cancer. The webinar is interactive, so over the next hour you can ask questions of the presenters by typing into the chat box, which is located at the bottom left-hand side of your screen. Questions will be answered at the end of each speaker's presentation. Please keep in mind that our presenters can't address individual medical cases. If you need further information, we'll provide details for our phone line at the end of the webinar. We're very pleased to welcome our presenters for today, Dr. Carrie Lethborg and Diane Gardner. Diane Gardner has worked in the museum and heritage sectors for the past 30 years. For her work in this area, she has been awarded the Museums Australia Award for Excellence and was appointed a member in the General Division of the Order of Australia in 2015. Diane continues to hold a number of executive roles in museum organisations. Today she's joined us to speak about her experience following a diagnosis of ovarian cancer in 2014. Dr. Carrie Lethborg has been a social worker and researcher in the setting of cancer for over 25 years. Her PhD study into the role of meaning in adjustment to advanced cancer has been developed into a meaning-based therapy for the palliative setting, which has been trialled at multiple hospitals. Amongst her many roles, she is clinical leader, researcher in social justice and health research, a specialist counsellor for the Breast Cancer Network Australia, and an honorary research fellow in psycho-oncology at multiple institutions. She is a regular speaker on the topic of adjusting to life after treatment for cancer. Both these women have extensive and interesting work histories and will publish their full bios on the website following this session. I'd now like to pass you over to Dr. Carrie Lethborg to begin.
Thank you very much, Hayley. I'll just move on to the next slide. I'm really pleased to be here presenting to you today on, I guess, the emotional impact of living with a cancer diagnosis and after treatment's finished. I think we talk a lot about the impact of treatment, the physical impact, those sorts of things, but the emotional impact is what people's left with. And I think it's really useful to look at the impact that it's had on each individual person and for you to be able to think about what that means for you and what you can do about integrating that into your life. People often talk about people who have had a cancer diagnosis as a survivor, and I find some people like that term and some people don't. I think the experience is a big life transition. It's when your current reality is really disrupted. So you're going along and you have plans for the next week and the next month, and you know who your friends are and you know what's going on with yourself medically, and then suddenly there's a cancer diagnosis. And I remember someone saying to me it was like the sky was blue and the sky was green and the grass was blue when they walked out of the doctor's surgery. Everything just felt different. You'll see there's a picture on the screen of a woman crossing a bridge, and I often think that that's a good analogy for that process of going from the start of the bridge, which is life as you knew it, and then having to cross over to this new reality, whatever that means for you. And this painting is actually of a blind woman going across a bridge, and I think that really speaks to some of the uncertainty. We did a study at St Vincent's Hospital asking women to tell us what their experience had been like with cancer, looking back. So it was a retrospective study, and I just want to give you some of the ideas of what they said and for you to think about whether that resonates with your experience. So the first part of their experience that they reflected on was that they went from being a well person to suddenly being a cancer patient. For some people that happened only in that moment that a diagnosis happens. And for some, it starts to happen when they think something's wrong and they start to worry that actually they're not a well person at that time. And if you see here, there's 3 columns. One is what they said the experience was like, and then what they had to kind of do, the adjustment task, and then how they managed it. So with this first phase, the diagnosis phase, it was really a experience of shock and bewilderment. And there had to be this process of managing this shock, making a lot of treatment decisions at a time when you probably shouldn't be making decisions because you're in shock, and trying to appraise the threat about, what does this mean? How bad is this for me? Let me give you a quote from one of the women from the study. She said, "It was one of those moments that will live on in life. It's scary. I hope I never have that moment when she tells me it's cancer." And another said, she described it like a photograph, the crying, the feeling of tears. Mum was at the end of the bed and she burst out crying and ran. I often hear people talk about this like they're watching themselves in a movie. And I think that's that experience of shock where you just can't believe it's happening to you. And there's such bewilderment, and yet there's such a lot of decisions to be made at that time. The next phase a lot of the women talked about was treatment. So they're now a cancer patient. They're in the middle of this experience. And the experience is really about just getting through treatment, because for whatever treatment each person had, it was really very disruptive and traumatic. There was psychological and physical trauma involved. So the adjustment task was managing this change reality. Maybe you suddenly have lots of new people at the house, people are bringing meals around, you've got medical appointments, you might not be working, there's lots of people around you that you love that are very worried. So this real disrupted reality. Learning to live with uncertainty and adapting to all these changes at the time. And I think coping with the impact on the people that you love is a real burden on top of all of that. But the interesting thing for me was that a lot of the women talked about this coping strategy of almost avoiding thinking about what this all meant at the time when they were going through treatment. And that's because it was so traumatic that they really just had to almost put blinkers on and just get through. There was a whole lot of thoughts about positive thinking and trying to just focus on the tasks and all the supports that are around, but that it was really a bit of a blur because you really just had to get through. I'll give you an example. One woman said it was just awful having treatment. It was bad or worse than I ever expected it to be. Each time you have a dose of chemotherapy, it takes longer for your body to get better. I just really couldn't see it ending. And another one said, during treatment, you're in go-forward mode. I really didn't stop to think about what was really happening to me. So it was in retrospect that they could look back and go, gosh, I really just had to focus on each day and getting through this period. But then treatment finished, and there was this transition from being a cancer patient to not really being sure what you call yourself. So for some, some women call themselves a survivor. Some say I had cancer and now I'm someone who has had a cancer history. And some people really feel that they're still living with cancer because there's so many ongoing issues. So part of it's actually that treatment completion is, who are you now at this point? So the experience of finishing treatment was one of absolutely relief, but mixed with a real ambivalence and fear, and beginning to process what just happened to you and what's going to go on in the future. And the adjustment task was about adapting to all these changes. You might have had friends that you thought would be there and they weren't, or friends that you didn't realise would be so amazing and they were there, or you might be rethinking work or relationships, or you may have ongoing physical traumas to go through. So there's adapting to all these changes and working out what life is now for you. So the coping strategy was about looking back and appraising from a distance, and then looking forward and hopefully being able to start to think about developing new goals for what this means. Let me give you another quote from that study. Annie said, whereas at the time of going through treatment, the time of being operated on and having all of that, it was a time when I really, I didn't think that I really had cancer. Looking back, I think it was unreal, whereas now it's becoming real. The reason why we did the study was that I was getting a lot of referrals of women when they'd finished treatment, and they'd said, when I was going through, I kind of coped okay, but now it's becoming real. And I think that's because you are far enough away from the trauma to be able to actually go, wow, that happened to me, and now what does that mean? Living through the experience of a diagnosis and treatment for cancer, I think, has a lot of similarities to living through any traumatic experience. If you read an account of someone who's been through a plane crash or have been lost for a number of days and then found, they'll talk about those phases as well. So the phase of it's happened and there's a shock, the phase of getting through the blur of the trauma, and then being at the end and having the after effects of what does this actually mean for me. I often use the term you've been through a major trauma when I'm talking to women that have been through a cancer experience, because I think sometimes we underplay the impact it's had on your life, even if you're doing really well physically now. So while a person is in the middle of a traumatic experience, we know that they're really seldom able to really focus on it at the time because you're in survival mode and you're just managing the trauma. Whereas at the end of it, it can be more of a time when it's time to process what has been the emotional impact. So I talked about this bridge, and I think this is another image that kind of resonates about crossing this bridge, and that is not knowing what's on the other end. So not only are you being asked to cross a bridge to a new reality, but no one can really tell you what the end of that bridge is going to be. And so, of course, what this means is learning to live with uncertainty, which takes, there are a number of strategies that can really help that. It's an uneasy experience, and I think all of us kind of kid ourselves that we know what's going to happen tomorrow and we have control. When you've had a cancer experience, I think that's taken away from you, and you realise that actually things can be turned upside down in an instant. So fear of recurrence, I think, is incredibly common for anyone who's been through the trauma of cancer. It's a really natural feeling. We know that a lot of people that have been through a cancer experience become really hypervigilant about physical things. So they get a sore or they get a headache or something happens and physically to them and they think it's coming back. It's something to do with the cancer. And that's understandable. What we find is that this second guessing happens commonly for most people, but it does diminish over time. And so you need to know that it's a normal response to the trauma that you've been through. So some, it might mean that you need some extra support to really put that in its place. And I think some of that being very aware of your body can be a useful thing if you can turn it into a positive, and that is that you become aware of when your body is stressed, and that is a reminder for you to be able to learn how to stop and get your needs met. So we're talking about some of the impact when your life is turned upside down. Emotional distress, I think, is something that is an incredibly normal experience for someone who's been through a cancer diagnosis, and I think the people around them as well. And yet I still hear a lot of women telling me that, they shouldn't get upset and they should be coping better and they should be grateful. So the first thing I want to say is that being distressed is a very normal response to an extraordinary circumstance. Having a cancer diagnosis, having to go through treatment is an extraordinary circumstance, and being distressed is the most normal response in the world. So acknowledging emotional distress can be really difficult for some, and for some who have seen themselves as someone who's always been able to cope with everything, they might see it as a failure and that they're not coping, when in fact it's very much an experience, a normal response. Doesn't mean that you are weak, it means that you're actually responding to having an enormous amount of pressure on you. And that for some it's going to be just a normal response that you will go through and it will diminish. For some it means that you need some additional support, and you might never have been someone who went to counselling or needed additional support or even had to say yes to offers of help. But this is an extraordinary circumstance, and so if that's you, then that just means it's part of your whole treatment plan. I really think that cancer happens to a whole family, and I use the term family loosely here. I think it's any group of people that are important to you in your life. And, you know, I use this picture that you'll see on the screen of a mobile because I think, first of all, it looks a little bit like a family tree. But I think when cancer happens, it's like you flick one of those pieces, and what happens with that mobile? The whole thing spins and twists. But each piece will probably move quite differently. Some will twist around, some might get tangled in the other, some might just move up and down. And I think we as healthcare professionals really need to address the impact on the entire family, if only for the reason that I think women who have a cancer experience really carry the burden of concern for the people around them. And I think family distress can really be guided by what's happening with patients. And so if you're not well, usually the family are struggling more. And if there's one thing we can do to support you, we probably need to be supporting families more. So I think that's an important part. So what are some of the things that we know can help? The first thing is that I think when you have a cancer experience, time can feel like it's very anxiety-provoking. And you start to think ahead, what does this mean for next Christmas? Or am I going to be this sick for my next birthday? Or am I going to be able to do the things that I had planned to do? I think one of the really important things is to be able to keep a perspective, and that involves taking each step. I'm just stopping for a minute because I think there's been an issue with the camera. Yep. Sorry, everyone. We're just getting cameras right so that you can still see everything. Okay. I'm going to keep going through the slides and we're going to try and work out the camera so you can still see me in a minute. So one of the really important things is about keeping perspective. So it's about not looking too far ahead if looking too far ahead makes you anxious. It's about pulling back to dealing with each issue as it comes. And if you see here in the picture, taking the first step rather than the whole staircase, and knowing that you can actually take each step even if the whole staircase looks really overwhelming. See this image here of a microscope. And if you think about a microscope, you can turn the buttons on the side of a microscope and you can either look much closer at an issue or you can pull back and you can see it much bigger. I think sometimes when we're starting to think too far ahead, you almost need to use this idea of a microscope where you pull back and you say, can I manage today? Can I make plans for this weekend? Do I feel comfortable being able to do that far ahead at the moment? There have been some women that I've spoken to who have been very anxious, and it's about, can I make it to lunchtime? Can I make one plan between now and lunchtime? And then it might get longer and longer. So part of it is keeping this perspective and really trying to pull yourself back when the anxiety about the future becomes so big. Let me read you this quote that I think is useful in this concept by Andre Dubos. It's about managing moments. It's not hard to live through a day if you can live through a moment. What creates despair is the imagination, which pretends that there's a future and insists on predicting millions of moments, thousands of days, and so drains you that you cannot live the moment at hand. We hear lots of platitudes about this, that if you are worrying about tomorrow or yesterday that you're not living right now. But it's very true, and I think when you're living with uncertainty, this can become very, very apparent. And the imagination absolutely can completely throw us because we can think, what about this? What if that? What if whatever happens? And so this is about trying to live in each moment, because that's probably how we should be living anyway. And it takes practice when you're feeling anxious. One of the ways that can be really useful is to think about the concept of cognitive behavioural links. So what we think and then what we do and then how we feel. So let me give you an example of that. If you have a situation, usually there's a thought that follows it, and then there's a feeling and then an action. I want to give you an example of this that you might kind of be able to think about. What I'm talking about here are automatic negative thoughts. So here's the example. The situation is you're called in for a repeat blood test by the hospital and they tell you it's nothing to worry about. Usually people laugh at this point. But the thought could be, you think, okay, this is worse than I thought it was going to be. I know that it's worse than they've told me. The treatment's not working, and you get very panicked. And then a whole lot of things happen to your body. Your heart begins to race. You might feel your temples are getting tense. You get a headache. Your shoulders get sore. And it might even be that you go from the phone call to these physical symptoms and you don't even kind of recognize this thought that you've had. But the action could be that you cancel coffee that you were going to have with your friend that afternoon and you call someone else to pick up the kids from school and you go to bed. And that's because the situation happens, a thought happens, a feeling happens, and then there you are feeling very tense and upset. Let me give you an alternative thinking way. So same thing happens, you get this phone call from the hospital, you need a repeat blood test. You think, I'm so grateful that the hospital is so thorough and double checks my tests, and I'm glad there's nothing to worry about. Probably going to the other extreme now of being a bit Pollyanna-ish. But you'll see that if that thought was different, then the feeling is different. You go from, I'm very happy to get this good news, you go and have coffee, you're happy, and you pick the kids up from school. The only thing that's changed here is the thought. Now, you might think I can't actually change my thoughts, but actually you can if you learn to be able to recognize what's happening, because often we have what are called automatic negative thoughts. We think the worst, and we need to stop and calm ourselves and think it through. So let me give you that scenario again. Same thing happens. Thought is, you think, oh my gosh, this is terrible. You start to feel all those experiences, and then you stop. And you say, okay, I know what's happening now. I'm doing a body scan. I'm getting tensed from that phone call. I need to calm myself down, clarify why I'm feeling like this. It's because of the phone call. And then to double check, okay, is this really as bad as it sounds? Am I making it worse in my head? So then there are a number of things you could actually do. You could call the hospital back and say, look, I know you rang and said it's nothing to worry about, but actually I'm really anxious now. Can I just check about why you called? And they might say, there's a whole batch of bloods that we're not sure about, and so we're calling a number of people in. And then you might go, oh gosh, okay, that's fine. If you're not able to do that and actually challenge it, you might decide to do something else to take your mind off it. So do some relaxation, going for a walk, doing something distracting, or go and have that coffee with your friend and talk to your friend about it. The thing is learning how to take charge of these feelings. And if you do this each time it happens, you can start to shift so that the phone call happens and your immediate thought isn't the worst in the world. Okay. Talked about the impact on emotions. I also think it's important to think about the impact on your relationship with the world and what's meaningful to you, because we know that meaning in life and the things that make us happy and that give us meaning in our life are really important and are more important when we're going through a traumatic experience. From the existentialists from years ago, we know that having meaning in our lives really buffers the anxieties and concerns that we can have. And this is not about the big questions like, why am I here, or what does the whole world mean? It's about the pursuit of little meanings. It's about the fascination with nature. And I think often when I speak to women that have been through a cancer experience, you know, sunsets are so much more amazing, or going for a walk on the beach is so much more important. We become much more clearer about the natural world and how important that is, and having more of that in our life. Doing what you love, which might not be stage diving like this guy, but it's actually looking at that feeling and going, yeah, that's how I feel when I do and making sure that you have more of those moments in your life so that you're filling it with the things that are meaningful. The wonder of play. It's no surprise to me that more adults are doing colouring in books now and thinking that that's actually okay, because it's about actually having moments where you take a break from, I guess, the burden of life. Kindness, still being able to give to others is really important even when you're in a traumatic experience. And noticing the simple beauty in the world. So it's not just acknowledging that you're walking down the street and, you know, right now all the leaves are starting to grow back on the trees after winter. It's actually noticing it and stopping and going, wow, that's really beautiful. And filling your life with those simple moments as well. Connections with others, it comes out in every study that we do as the most important thing in terms of getting through any trauma. Those that have meaning and have connection with other people get through regardless of what they're having to face. It's incredibly important for you to be having those connections with others. And I think thinking about what are you bringing to this experience? So you might want to look at your current circumstances. And I imagine that for those listening, there's going to be some women that have just been diagnosed, some that have been living with this experience for a long time, and everyone in between. What are you doing to take care of yourself? Are you getting the best medical care? Are you getting your questions answered? Do you need more information or more support? Are you seeking and finding support and encouragement from those that you love around you? And whatever pain or discomfort that you're feeling at the moment, do you have a sense that there is still meaning and purpose in your life? And if life has become really so saturated by cancer and medicine and doctors and all of those experiences, how do you bring back what's meaningful to you? If there's something more from the many possibilities open to you now, what might enhance and enrich your life right now, even with whatever things that you're dealing with at the moment? I think at each stage in an experience, it's important to be able to stop and go, okay, what do I need right now? I'm going to finish with a couple of slides here before we move on. One is that courage does not always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow. I think we need to be much more gentle on ourselves. We need to remind ourselves that actually just getting through days sometimes is an enormous gift and something that we really should pat ourselves on the back for. Often I hear women say, people say to me, I'm looking good, and I feel really angry when they're saying that because they don't know what it's like for me to just get through a day. So knowing that just saying I'm going to try again tomorrow on some days that are really hard can be enough.
Thank you, Carrie. Thank you. There's a lot of really great information and strategies in that presentation. And apologies because you might have found that you lost visual on Carrie partway through that presentation, and we're just currently trying to get that back for her. Now, we did have some questions that were sent in before the webinar, and the question, Carrie, which I'll pose to you, and again, sorry, we might have to just hear the lovely Carrie's voice as opposed to seeing her face. Oh no, we do have her face, that's great. So the question, Carrie, that we had before the webinar was, how do I cope with advocating for myself when I feel like I'm not being heard with by my doctor? So how do I cope with those feelings, and how do I go about dealing with that?
Thanks for that question, Hayley. I think this experience presents us with so many new things that we have to play new roles in. And I often hear women say to me they've learned how to say no for the first time. One of the things you might need to do for the first time is you might have a view that doctors are very busy and very important, and I go in and I speak to them and they're not, I can't bother them too much. It's time to actually be pushy. It's time to realise that your life is really important, and if you're not being heard, actually working out how either you can say or a support person can come with you and say, I actually need the answer to A, B, and C before I leave today. Actually, I really need this to be able to cope. Now, it might be that you can get those answers from your doctor. It might be that you get a support nurse or another healthcare professional. It might be a social worker at your hospital that you can ask, can they actually help you get the answers to this? You might bring in a loved one with you to see the doctor. Write down the question. And I think the important thing to be asking yourself is, what do I want to know before I leave this surgery today when I'm seeing the doctor? It might be that you have a whole lot of questions, but actually what you want to know is, I don't know, what's the goal of this treatment? Or this symptom, no one's listening to me, this symptom's really bad, I really need an answer to this. And so this is about learning how to be bold for your own needs and gathering the support around you if it's really feeling too hard for yourself. It's also fine for you to ask for a second opinion and to actually ask around and see someone else and ask them, I'm really struggling with this because I'm not getting my needs met here. Can I see you and see if you are able to give me the support? I know these are very difficult things to do, but I know a number of women who have never been someone who stood up for themselves before, who have done it and really feel like, do you know what, I deserve to get answers. So I guess just to reiterate, it's about being very clear what you really need to know. So I think that this idea of lots of questions is very normal, but what is it that's really bothering you? And then is there a way you can sit the doctor down and say, before I leave today, I need this answer? Getting support from other healthcare team members at the hospital that you go to if that's available to you, having a support person going with you. And finally, and I think it's really worth taking that to your doctor that's looked after you, but if you really feel like you're not getting that relationship that you need, it might be that you need to ask to see a different medical person if that's possible as well. It's about really acknowledging that you're important enough for this, and at the moment you're dealing with something very serious, and it's okay to want to know answers. I hope that answers the question.
Thank you so much, Carrie. That's really useful for women out there. So first of all, I'd like to say if any other questions do come up for the rest of the presentation for Carrie or for our next presenter, please don't hesitate to type them in the box in the corner on the left, and we'll have a bit more time at the end for some more questions and more discussion. But in the meantime, I'd like to invite Diane Gardner to share her story.